Good day everyone, my name is Rita Gwendolyn A. Agno. So today I will be discussing an important area within the field of psychopharmacology. How various classes of psychiatric medication influence brain chemistry and behavior. Especially I will focus on three major groups, which is stimulants, antidepressants, and antipsychotics. First is the stimulants. Let us begin with stimulants, a class of medication most commonly prescribed for attention deficit hyperactivity disorder, which is ADHD, and narcolepsy. Some widely used examples include methylphenidate, known commercially as Ritalin or Ritalin, and amphetamine-based medications such as Adderall. These drugs are classified as central nervous system stimulants. So how do they work? So stimulants primarily act on the dopaminergic and noradrenergic system in the brain. They increase the ability of dopamine and norepinephrine, two key neurotransmitters involved in attention, motivation, and alertness. They do this by promoting the release of these chemicals from using neurons and inhibiting their reuptake, meaning the neurotransmitters remain active in the brain for a longer period. So the behavioral effects are typically quite noticeable. Users often report enhanced concentration, reduced impulsivity, and increased energy levels. This makes this medication particularly effective for individuals who struggle with sustained attention, such as those ADHD. So, however, it's important to note that this medication comes with potential side effects such as increased heart rate, insomnia, and potential for misuse or dependence if not taken as prescribed. In conclusion, psychopharmacology provides us with powerful tools to influence the brain's chemistry and, by extension, human behavior and mental health. Each class of medication, stimulant, antidepressant, and antipsychotics, interacts with the brain neurotransmitter systems in unique ways. Understanding these mechanisms not only help guide treatment but also highlights the delicate balance required when altering brain chemistry.
Next, let's explore antidepressants, which are primarily used to manage depression, anxiety disorders, and some strong pain conditions. There are several types of antidepressants, each with slightly different mechanism of action. SSRIs, or selective serotonin reuptake inhibitors. These are often considered the first-line treatment for depression and anxiety due to their favorable side effect profile. Common examples include fluoxetine or Prozac and sertraline or Zoloft. This medication works by blocking the reabsorption or reuptake of serotonin in the brain. By doing so, they increase the amount of serotonin available in the sympathetic cleft, the space between neurons, thereby enhancing mood and emotion regulation over time. So letter B is SNRI or serotonin norepinephrine reuptake inhibitors. Drugs like venlafaxine or Effexor belong to this group. They act similarly to SSRI but also target norepinephrine in addition to serotonin. This dual action can be particularly effective for individuals experiencing both emotion and physically symptoms or depression, such as fatigue and chronic pain. So letter C is tricyclic antidepressant, older but still occasionally used. Examples include amitriptyline or TECAS or TCA. Also block the reuptake of serotonin and norepinephrine, but in a less selective way, affecting other neurotransmitter system as well. This broader activity contribute to a higher likelihood of side effects, including dry lips or dry mouth, constipation, dizziness, and even cardiac issues, which is why they are typically used only when other treatments are ineffectively. The next one is letter D. Monoamine oxidase inhibitors, an even older class or MAOI, or such as monoamine oxidase inhibitors, such as phenethyzine, where definitely they inhibit the activity of the enzyme monoamine oxidase, which is responsibly by breaking down serotonin or dopamine and norepinephrine by preventing this breakdown. MAOI effectively raise the levels of this mode regulating neurotransmitter. However, they require strict dietary restriction and have potentially dangerous interaction, limiting their use to more persistent cases of depression. In summary, antidepressant targets serotonin, norepinephrine, and sometimes dopamine, all of which are central to mood, motivation, and anxiety regulation.
Finally, let's discuss antipsychotic, a class of medication used primarily to treat schizophrenia, bipolar disorder, and sometimes serve depression or mania. First generation antipsychotic are also called typical antipsychotic. They mostly block your dopamine receptors to help with your symptoms. Doctors also prescribe gas for other mental health conditions like acute mania, agitation, and bipolar disorder. So ayun nga, ito daw ay nakakatulong para harangan ng mga dopamine receptors para tumulong sa mga sintomas at nireresita din po ito ng mga doktor ang efagas para condition sa kalusugan ng isip tulad ng acute mania, agitation, at bipolar disorder. Talk about risperidone because this is a very popular antipsychotic that we use a lot of times in inefficient settings. So risperidone fell in the category of typical antipsychotic. So basically what that means, it's called a medication that works specifically regulating dopamine in your brain. Now dopamine with its out of whack basically is the reason for the psychotic feature that you see with patients like that have a schizoaffective disorder, and this medication it is the good job trying to get those pack in balance. Now, dopamine is responsible for the hallucination. Number 2 is a type of second generation antipsychotic. Example include risperidone and olanzapine. This drug also block dopamine receptors, but with a broader action, they additional block serotonin receptors. Particularly, this dual mechanism provides broader symptoms control, especially for negative symptoms like social withdrawal and appetite, while reducing the risk of motor side effects seen in first generation anxiety. A well-known example is haloperidol. This drug works by blocking dopamine D2 and receptors. And work by blocking dopamine D2, it would help reduce symptoms like hallucination and delusions, commonly associated with psychotic disorders. However, this medication also block dopamine in pathway related to motor control, which can lead to extra paramedical symptoms such as muscle stiffness.